In recent years, there's been an accelerated use of digital innovations to improve the quality of perinatal care. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Executive Speechwriter with AHA. Technology has become a critical aspect of healthcare delivery. Digital solutions have provided avenues for improved access to OBGYNs, doulas, lactation consultants, specialists, and more. Apps for remote patient monitoring or chat and text-based navigation services offer additional ways to support and coordinate care. Joining Priya Bathija, Vice President of AHA Strategic Initiatives, is Dr. Alisahah Cole, who serves as the System Vice President of Population Health Innovation and Policy at CommonSpirit Health. Dr. Cole will share how CommonSpirit Health's use of Docent Health, a consumer engagement and patient navigation technology and service, has improved perinatal outcomes. This podcast is part of AHA's 7 in 7 series.
Thank you, Tom. And Dr. Cole, thank you so much for speaking with me today. I know that at CommonSpirit, you're using Docent Health's technology to improve perinatal care. Can you tell us a little bit about the solution you're using and how it works?
Thank you for having me. At CommonSpirit, we identified healthy birth outcomes as a key area of focus for us, both from a clinical standpoint, but also from a health equity standpoint. And so one of the things that we really wanted to make sure our patients had was navigation. So how do you really help the mom throughout her pregnancy journey and postpartum journey, making sure to connect her to the resources that she needs, and also helping her to advocate for herself and for her children. And so Docent Health is a virtual patient navigation solution that has been really great in helping us provide this resource to our patients.
That's great. And can you tell us some of the outcomes and successes you've had since implementing Docent?
Yeah, so this was one of those things that we actually had the opportunity to do a pilot some years back. And we looked at different bundles of care, maternity journey being one of them. And what we saw in that pilot, which was in 3 of our facilities at the time, was a significant reduction in length of stay for both our moms, but also for infants who may have went to the NICU, and especially in our patients who had Medicaid. So that was critically important from a cost savings and utilization standpoint. And we also saw a 37% reduction in preterm births in our moms who had Medicaid. And so we're in the process now of scaling the program. We are currently live in 5 facilities between California and Arizona. And we are looking to scale it to all 68 of our facilities across half the country that provide maternity services.
Can you talk to how mothers are responding to using Docent and the information that they now have as a result of being able to use this solution?
For me, one of my favorite things about this program is getting those testimonials and that feedback directly from the patients. And I will say, especially since COVID, the moms have really felt connected to our care team because the docents end up kind of being a care extender, if you will. And so, I mean, we've had so many great comments around thank you for the service. Thank you for connecting me to resources. Thank you for helping me to advocate for myself. So it's just been amazing to get that information. From a health equity standpoint, one of the things that we wanted to make sure was that we were really engaging all different populations. And so we actually look at our engagement rates segmented by race and ethnicity. And one of the other things that's been really exciting for me is that we continue to have over a 65% engagement rate total. But in our communities of color, especially our Black and African American, Hispanic, and Asian communities, we added a screening for social determinants of health and also behavioral health. We've had a lot of comments from our patients about thank you for adding this component because I didn't necessarily tell my doctor that I'm having issues with getting food. But they established this relationship with the docent, and the docent's able to connect them or navigate them to resources in their local communities.
Just one last question for you today, Dr. Cole. As you roll out digital solutions, whether it's Docent Health or other solutions at CommonSpirit, there are often people who can't take advantage of these solutions, whether that's because they don't have access to Wi-Fi or, the right kind of smartphone, or they don't understand it based on language restrictions or limitations. What are you doing to address digital health equity for your patients?
That is such an important question. So, whenever we're talking to vendors or talking about our own in house solutions, we have equity as a part of that conversation, and it's built in from the beginning, which is just, I think, is one critical thing, a takeaway, if you will, for
Mhm.
people to think about is, how have you embedded equity in your strategy around all of these different new solutions? But that's one of the reasons we actually went with Docent for this platform, because it's a text-based and call solution. It's not a video chat kind of a framework, because we recognize that people may not have a smartphone, or they may not have Wi-Fi, or access to broadband, et cetera. So we wanted to make sure we had a solution. And then the other thing is looking at data, right? So are you looking at your usage of these technologies and these solutions through different lenses? Are you looking at it by race and ethnicity, language, to your point? Are you looking at it by social vulnerability? There's so many different ways that you can look at data, and again, being really thoughtful about that. And so one of the things from a language standpoint, in one of our communities in Central Coast, California, not only did we need to make sure we had Spanish capabilities
Mhm.
and docents who were fluent in Spanish, but there's a specific dialect called Mixteco. So we needed to make sure that we had fluent docents who spoke Mixteco. And that was something that we had to build into the solution for that market. So again, there's a way to, I always say, operationalize health equity if you're being thoughtful and intentional about it from the beginning.
Thank you. And thank you, Dr. Cole, for sharing the outcomes you're having with Docent and for being with me today for this conversation. And to our listeners, thank you for joining in, and stay tuned for upcoming podcasts in the 7 and 7 series.